I'm Robin Castleman, and I'm here today with Dr. Matt Wallace from the Regenerative Center. And Dr. Matt, I know you see patients for a variety of reasons, but let's talk about sports injuries, like maybe with the kiddos first, because it's fall sports season, and here we are. So what are you seeing, and how do you do it?
Yeah, so, you know, a lot of times we don't see a lot of really small kids, and honestly, probably no one sees a lot of small ones because our bodies heal real easy. You know, when you're young, things are healing good. And I kind of brought always my little tools. So this is like a ligament. So if they were to injure a ligament that holds their bones together, their ligaments are really strong and they're thick and big, and so like a big strong rubber band. They generally heal good, plus they have a lot of blood supply still. So up until you're about 18 or 20, every part of your body has a lot of blood supply because your stem cells leave your bone marrow, and that's how you build your body. After 18 or 20, this is when we start seeing the patients in those later high school years into college. You'll see patients come in, and now they've got some issues that aren't getting better, and they're really concerned about that. So that's the type of people we don't see a lot of pediatrics coming through offices.
Okay, so lots of pickleball action happening now, and I feel like my ligaments are the other rubber band that you have now sometimes, yes.
So this is kind of what happens as we age. Just aging, sometimes just overuse, our ligaments and tendons start to wear down, they get thinner. So kind of like this one. So can you imagine if this were holding your shoulder together or your knee? And so this is what happens when you go out and you're a weekend warrior. Your tissues are just not as nice and thick as they used to be. And sometimes we injure those, but the bigger problem is they lack blood supply. They're avascular for the most part. So what happens, our body again can heal. You cut your skin. I'm sure you shave your legs. I hope you do.
I do.
I shave my face. If we get a cut, we don't go to the doctor.
Right.
Why? Because that tissue has a lot of blood supply, and our injured cells recruit good cells there. But these tissues, for the most part, are avascular. I always say that a lot of orthos probably wouldn't have a job, unfortunately, if there was blood supply in these tissues. But they tend to not heal very well.
Okay. So what do we do about that?
So what we do about it, I brought this other one little piece. Sometimes people here, you know, have a torn rotator, have a torn meniscus. So anytime somebody says I have a tear, they panic. But I like to always demonstrate with our patients, sometimes tear just means this. So if this were holding the bone together, it's got a tear in it, but it's not, it can still work. Sometimes the tear gets a bit bigger, but again, still works. The ones that you can't really fix, even these kind of work good. Those are the ones you can't fix. And so when something's torn off of the bone, honestly, it's very uncommon. And most of the time, things just have tears in them, and that's where they come to us, and we are able to take cells out of their body and then put them into areas that don't have blood supply and just watch that get better. Often we have to put a brace on or stop some activity for a bit, which people hate, but we can rebuild tissue, and we see these patients getting better. And you know, and anytime you do surgery, I'm not saying it's bad, but any surgical intervention, you're changing the normal anatomy structure, which can lead to other body part failures.
So we still have lots of, I know that you are having lots of success fixing these sorts of things without surgery.
We do, and I think patients really do like to use their own, you know, human ability to heal themselves. We just have to build a protocol. We see patients from all over the country will come in, and sometimes they can come 3 times. Sometimes some of our spine patients are here for a couple of weeks sometimes, and they're doing care to rebuild some of that tissue and just get their life back. So that's what we do at the Regenerative Rehabilitation Center over there.
And we don't need a referral. We can just call.
Don't need a referral, just call, and we're happy to see you and just talk through some things before you even have to decide what you want to do.
I love your explanations. You always tell it so that we understand it. So thank you for being here with me.
You bet.
All right. If you would like to revisit this segment of Health Experts, log on to WPSD-Local6.com and click Health Experts. Up next, Kelsey Bradford from Davis Drugs is going to be here with me, and she's going to talk about vaccines. That's after this on WPSD Local 6 Midday.
Paducah, Murray.